Prevention is for everyone, including people living with HIV, and that's a really important conversation. So let's chat. Treatment as prevention, TSP, is grounded in one of the most significant findings in HIV medicine. When a person is on treatment and sticks to it, the HIV virus cannot be detected in their blood. That's called an undetectable viral load. That means that sexual partners cannot acquire HIV from them. Undetectable equals untransmittable. U equals you. Have you heard about it? I think you have. But TSP is not just about transmission. When a low viral load exists, this can prevent HIV from progressing to AIDS and also reduces vulnerability of other infections that can compromise the immunity. Viral load testing is how you know it's working, and that is another form of self-knowledge. There is a narrative that places the entire weight of HIV prevention on people who are living with HIV, as if them sticking to treatment is something that they owe the world. But sticking to treatment is first and foremost something that a person does for themselves, for their health, and for their life, and for the people that they're building that life with. For partners who are in relationships with differing HIV statuses, for pregnant and breastfeeding mothers who are protecting their children. This is self-protection in one of its most profound forms. And treatment is belonging to you. That is the message, period. And sticking to treatment is so much more than just simply having willpower. There's stigma in healthcare settings. There's the emotional weight of having to manage a chronic condition in a world that still views HIV as some form of a moral failing, violence, food insecurity. These aren't excuses. This is the real landscape that people are navigating every single day. And when we reduce adherence to simple willpower, we erase all of that. Naming these barriers is the first step in dismantling them together.
This series has covered kindness, then Acavavir, PrEP, HEC, and now TSP. Biomedical tools, behavioral choices, and structural realities. That's combination prevention, and you just learned that. Woo! That has been the common thread that has been tying this whole series in the conversations we've had. If I want you to take away anything from this series, is that no single tool works alone, and no single person carries it.
And now it's time to hand it over because the deeper conversations starts and belongs in communities. So we're going to hear from them real soon. So stick around. But bye for now, and thank you for joining me.